one of the major challenge was, getting the two cells to be, to culture them, finding the appropriate media that is not necessarily best for individual cell types like myocytes and motor neurons, but is optimal for both of them together. So it's a fine balance of cell culture, media optimization, making sure that the skeletal muscles in vitro, they mature enough, and we have motor neurons also, they are also happy in that culture. So that was the in vitro challenge which we faced. And then later on, when we were doing the in vivo studies, some of the challenge was optimizing the surgical model. It's a very traumatic injury to the animals, and getting that surgical model up and running, and making sure that there is less amount of inflammation, and so we create a defect in the rat tibialis anterior muscle to make this model. So we had to make sure that the surgery was consistent enough that every time the injury was similar. So those were some of the challenges. But overall, it has been a very fruitful experience, and we are really excited in our ongoing studies as well as for the longer term studies. So one of the things that we are doing right now is, so there are two ways that we are moving this research forward in our lab. One is the in vitro component and the in vivo component. In the in vitro component, we are now moving towards human iPSC-derived cells, so which can eventually lead to patient-derived cells in a clinical scenario, as well as the in vivo component. We are trying to mimic what a trauma surgeon faces and deals with every day, because we have now developed a delayed repair model where the injury is created in the animal, but will the animal sit for a certain period of time before we go in and do the repair, which is exactly what the trauma surgeons in the field will face. Like the patients won't come immediately after getting the injury. So we are trying to make it more clinically relevant in these two ways. And we have got some exciting results till now. Like we have ongoing in vivo studies with human cell-derived these neuromuscular constructs, and as well as applying them in this delayed repair model of volumetric muscle loss.